So hi everyone, my name is Kacee Ross and I'm going to start off our presentation with my teammates Shahidul and Xiao. We're from the Department of Consumer and Design Sciences, and this research is under the advising of Dr. Huang, titled Designing an Intelligent Decision Assistant for Older Adults, Application for Medicare Plan Finder. Do you think you could put it in presentation mode? Okay, awesome. So the context of what we're looking at here are conversational AI agents. So think about Siri or Alexa or Google Home. These are all electronic tools that are designed to help you make a decision through conversation. And in our study, we're also interested in designing an AI agent that has a conversation, particularly to help users make a health-related decision. We're focusing on the Medicare platform, specifically Part D or prescription drug plans, and the decision tool currently available to users is known as the Medicare Plan Finder, which is located on Medicare.gov's website. As you can see with the picture screenshot, it is not a conversational agent, but rather a basic interface with some basic features. So since we're looking at Medicare, our study population is older adults, which we know from previous studies may battle with some cognitive age barriers like computer literacy. And every year, millions enroll in a Part D plan, and the only avenue for them to make a plan selection is through the MPF. Not only are users typically given a large pool to select plans from, they also have to consider a wide range of individual plan attributes, which makes their decisions extremely complex, especially for older adults who may struggle with some age-related cognitive barriers. You can go to the next slide.
Yeah, the next.
So with these different needs in mind, the purpose of this research is to design, develop, and test an intelligent decision agent that functions like conversational AI that can provide older adults with the real support that they need to make a plan selection. To meet this purpose, this project includes 3 phases. First, identifying the problems using an observational study with real adults. Second, modeling and designing an intelligent agent architecture. And last, evaluating the effectiveness of the agent that we design. In this presentation, we're going to focus on phase 1 of this project, where we observed real beneficiaries using the Medicare Plan Finder to make a plan selection in order to help us identify the types of challenges and assistance that they needed.
We divided this presentation into 5 parts. First, the research method used in the phase 1 will be described. Afterwards, the findings on Medicare plan attributes, MPF functions, and decision strategies will be presented, followed by a slide with the overall findings. In the phase 1, we conducted an observational study of 29 participants during the open enrollment period of 2019. Participants who agreed to volunteer for the study first completed a pre-session questionnaire. Then each participant was randomly paired with a trained Medicare counselor. Following these, participants performed the Medicare Part D plan selection task on MPF, integrating a think aloud approach whereby they were encouraged to ask questions to counselor needed for the task. Following the task, participants completed a questionnaire which asked several decisional and experience-related questions. Besides, counselor completed an observational protocol after each session.
So the first part is about plan attribute consideration while selecting a plan on MPF with counselor's intervention. An optimal Medicare drug plan would be the one with greatest coverage at lowest cost. However, many older adults tend to overweigh some plan attributes such as cost, carrier reputation, to some other attributes like plan coverage, or even ignore some such as star ratings. But the existing literature lacks the views from both beneficiaries and counselors, and even less focused on MPF use. So to fill these gaps, we have 2 research questions. What plan attributes do beneficiaries consider, and what potential influence counselors may have on beneficiaries' plan attribute consideration? To answer the questions, we analyzed our data based on 3 stages. First, before going on MPF, based on participants' questionnaire. Second, on MPF, before counselor's intervention based on participant audio transcripts. And last, on MPF, after counselor's intervention started based on both participants and counselor's audio transcripts, as well as their questionnaires. So in the first stage, participants voluntarily mentioned 10 attributes and majorly focused on the total cost. Then in the second stage, they consider additional 3 attributes using MPF, but still mainly focused on the cost-related attributes. In the third stage with intervention, a total of 13 attributes were considered by participants. Their questionnaire data showed that besides the cost-related attributes, participants started to notice the importance of other attributes, the medication coverage, pharmacy coverage, star rating. Interestingly, the 2 coverage attributes, medication and pharmacy, were among the top 3 important attributes they perceived. Next, star rating, it was never considered or was less frequently mentioned in previous stage, but was perceived as more important than reputation in stage 3. Now let's see what counselors did. From their transcripts and questionnaires, we can see reputation was the only attribute counselors mentioned less frequently than participants. They did emphasize the importance of medication coverage, pharmacy coverage, and star rating during the intervention stage, which means counselor did influence beneficiaries' plan attribute consideration.
Now I'm going to share my findings on the MPF function part. MPF, a decision support tool on Medicare.gov, avails functions to help older users simplify their plan selection. But many users may be unaware of MPF functions, either they cannot locate them or less desire to voluntarily use them. Existing literature lacks the knowledge on older adults' utilization of MPF functions and the impact of counselor intervention. Therefore, we are going to have 2 research questions. The first research question was about the functions that older adults use during a Medicare plan selection. By analyzing audio, video data, and post-session questionnaire, the current study identified 12 MPF functions used by participants while choosing Medicare drug plans. However, participants utilized a very few functions voluntarily during the self-moment or before any meaningful interaction with a counselor, as you can see in the table in red highlight. The second research question is about the impact of counseling session on older adults' MPF function uses. The triangulation of 4 types of data suggested that counselor intervention influenced participants' function uses during the plan selection. Participants' voluntary use of MPF functions were very limited. However, the contrast in function uses before and after the counselor intervention was illustrated through this graph. We can see here with the counselor assistance, the uses of sort plans, filter plans, and star rating functions were significantly increased.
So lastly, we also wanted to understand how older adults are cognitively processing decisions while using MPF. So we examined different decision strategies they're using while making a selection and those intervened by the counselors in our study. Specifically, we looked at 5 different consumer decision-making strategies that are rooted in psychological theories, and we took the 29 participant counselor transcriptions and coded each of them for these strategies. Starting with the simplest strategy, Lex. This would be when a user selects a plan based on a prime attribute. The SAT strategy would be when a user selects the first plan that satisfies a minimum cutoff. So in the case where a user is just scrolling their search results and they select the first plan that satisfies them. EBA is when the user is successively eliminating different plans that do not meet a criteria across different attributes until one remains. MCD is comparing 2 plans at a time, maybe adding and taking away different plans based on a desired attribute. And finally, WAD, our most complex strategy we looked at, is when users compare multiple plans across several attributes and mentally conduct trade-offs. You can go to the next one. Okay. So we had 2 research questions in mind. The first one being, before counselors intervene in the decision, which strategies were older adults using? our findings showed that 7 participants were not using a strategy at all. This means that they were basically sitting idle or were confused prior to the counselors intervening. On the other hand, 19 out of 29 participants were using one strategy prior to counselors' intervention. And out of those, SAT was the most overwhelmingly used, meaning that participants were typically scrolling their initial search results page and simply selecting the first plan that met a minimum attribute, showing us that they were not using the most optimal strategy when left alone. We can go next. The second research question we had was to figure out if the counselor interventions were impacting user strategies. LEX and MCD were most frequently promoted by counselors, which you can see in the table on the left, and as you can see in the table on the right, were also the most frequently adopted strategies by participants. These strategies are more optimized for a well-rounded decision than the SAT strategy, which, as we saw, was the most frequently used strategy before counselors stepped in. Importantly, overall, our data showed us that out of the 88 instances that counselors promoted a strategy, participants adopted that strategy 51 times, or about 58% of the time. So in summary, the goal of phase 1 of this project was to identify challenges and different needs of older adults that are posed with a real-life MPF plan selection, and our study allowed us to meet this goal with several findings. Older adults were definitely challenged in considering plan attributes, utilizing different MPF functions, and combining and or switching between multiple and optimal decision strategies. But counselors' interventions were seen to help overcome all of these challenges. In conclusion, our findings can provide guidance for designing an on-screen, on-demand intelligent decision assistant, and they also implicate a broader applicability for AI development in other e-healthcare decision tools, not only for older adults, but for other underserved populations. And that's it.
Thank you, guys.